Welcome, welcome, welcome everyone to In the Loop Lupus live with Lupus in Color. We are on Facebook, Instagram, and YouTube. So hopefully, can you hear me? Let's try this again. Hold on. Can you hear me, Elizabeth? I'm looking at you. Okay. So I tell you, we've been using this stuff for how long now? I don't know why. But welcome to In the Loop with Lupus in Color, Lupus Live. We have a great warrior, but of course, as usual, we want to make sure that we have our disclaimer out there. So let's read this disclaimer so that you can get an idea of what we're talking about. Okay. So, in our disclaimer, the information and our answers provided during Lupus in Color videos and live events are not meant to be used as a substitute for professional medical advice. The information contained in any video or live event is not intended to recommend the self management of health problems or wellness. It is not intended to endorse or recommend any particular type of medical treatment. Should any attendee have any healthcare related questions, promptly call or consult your physician or healthcare provider. Persons accessing this information assume full responsibility for the use of the information and understand and agree that Lupus in Color or its presenters are not responsible or liable for any claim, loss, or damage arising from the use of the information. Okay, we got all that out the way. I'm so excited that you all are here. I think that you all are going to enjoy our story from our lupus warrior, Elizabeth. And I want to read her bio so that we can know a little bit about her before she comes on. So, Elizabeth Shin is a graceful warrior and motivational speaker. She is a brave and experienced fighter, conquering invisible challenges with courage and grace daily. She's an international transformational speaker, healthcare provider, author, and founder of I Am Shin LLC. She resides on the Pacific Northwest Coast in Seattle, Washington, hence why it's 11:30 in the East Coast and 8:30 in the West Coast. Life experience has also allowed her to develop actionable strategies for mastering your mindset, conquering adversity, and transitioning from a victim to a victor. Ooh, that right there alone is a powerful statement. So without further ado, I'm gonna bring Elizabeth up so she can share her story. Hi, Elizabeth.
Hi,
How are you?
I'm doing well. Thank you so much for having me. I greatly appreciate this opportunity.
Oh, I'm so excited to hear your story. I'm so excited to share your story. So let's jump right on into it because I know you've been working all day and I want to be respectful of your time.
And thank you for everyone who's staying up late on the East Coast and around the
Oh, yeah.
world. This is a very late
That's
interview
all
and
right.
podcast, so we're very grateful for that.
That's all right. We still have some people on. Some of our regulars are on saying good evening, and there are people on Instagram as well. So let's get into it. Tell me a little bit about yourself and tell me when you were diagnosed.
My name is Elizabeth Shin. I am known as I Am Shin all across social media. My official diagnosis came roughly 3 years ago. However, about 12 years ago, lupus was first introduced into my life. And initially, I didn't meet all of the criteria at the time. So I would always have 3 out of 4 things. So I never officially got my diagnosis. However, I was monitored monthly with urine and blood test for a year. And then it went to every 6 months. And I had tons of lab work done, saw multiple doctors, and it all started with a butterfly rash on my face.
Wow.
And the provider that I saw initially was very well educated, informed me, educated me, and urged me immediately to go to the emergency room. I was a little
Mm,
stubborn, didn't know what fatigue was at that moment. I just wanted to go home and sleep. And I was like, are you sure this isn't like, something that's just irritating my skin? And she showed me all these books and I work in healthcare, and at that time, I was just finishing school, just getting into my career, and I was like, "I've heard of lupus, but I don't know anything about it." And, within 24 hours, I was in the emergency room, and one
Mhm.
of my worst experiences ever,
Mm,
immediately, was just gaslit from the nurse, the triage nurse,
mm.
treated very differently, and then the emergency room doctor also concurred that he thought I was having an onset flare, and so it started a whole bunch of testing. I went several years with no treatment, unmanaged, sick, constantly sick, and then finally during the pandemic, I, officially got my diagnosis thanks to an awesome team I have here in Seattle.
Wow. Wow. So you started with the butterfly rash.
Oh, it was I wish at that time that I know what I know now about, like, photographing your body, it
Yeah.
was distinct
Oh, really? Really?
af after sun exposure.
Well, yeah, of course, of course. And you were young, so you probably had some other symptoms that you probably missed along the way, just thinking it's just life going on and you getting older and things like that.
Sort of. After talking with my parents and looking back all throughout my childhood, it's always taken me longer to heal from certain things, and I would always catch like random things, and it just took me a long time to fight. And my parents tried to advocate for me when I was younger, and it just took my body a lot longer to recover from certain things.
Mm,
And
mm,
then, I started noticing joint changes, and I would go to the doctor, and I literally felt like the Tin Man, and I was like, "I just want a can of WD-40." And I was just like and, he was like, "Oh, some arthritic changes and family history," and I had did a extensive family tree from my rheumatologist in Philadelphia, extensive family tree. And
mhm,
so it wasn't about whether or not it had lupus, it was about when would it show up completely and how
mm.
aggressive would it be.
So, in doing your background checks and all of that, eh, everything about your family history, you saw other autoimmune diseases in that family history?
Yes, so
Wow.
juvenile, rheumatoid arthritis, lupus, um,
Wow.
sarcoidosis, arthritis, inflammatory arthritis, a lot of rheumatic diseases all from one side of the family.
Wow.
A lot of it branches off from second cousins and first cousins. No immediate, siblings, and my parents don't have anything, but genetically, I had disposition to it, and I was a rough, rough little girl. There was nothing graceful about me in my youth. I loved to get dirty and play with dirt and mud and ride bicycles, and I had physical trauma. I was hit by a car, just different things. And so, as we know, environment, genetic factors all play a part. It's like the trifecta. And
Right.
so, I've shown symptoms for quite a while, but I did officially get my diagnosis. And it's funny because I got my diagnosis through a My Chart text message, like the official, no, you have lupus came through a My Chart message. But
Really?
I was anticipating that. It was like, finally, I got to
Uh-oh, you're frozen.
have lupus. And
Repeat
so, for
repeat
a moment, I
repeat
was like,
that
do I
one more
have
time.
both? Initially, when I saw the rheumatologist and they compared my labs and everything, she was going to diagnose me with undifferentiated connective tissue disease.
Mhm.
And she said, I want to wait till a few more tests come back. And I can tell you whether or not you have only this or you have this and lupus.
I
And
got
so
you.
when I got the text message regarding my labs, I was like, so do I have both or do I just have lupus?
Right,
And so
right.
she was like, "No, you have lupus."
And you have systemic lupus, correct?
I do. I have SLE. I've had it for a minimum 12 years. I've had other signs of it. Since I've got my official diagnosis, my symptoms, my illness, and everything else has become so much more manageable. And
Mhm.
I'm very grateful for my PCP because there was several times where I had mentioned to him, like part of it was I lived on the East Coast for so many years, and so I
Mhm.
transferred providers to the West Coast. And because I wasn't seeing a rheumatologist here, my rheumatologist in Philadelphia before I moved to Seattle explained to me a list of things. If, go to the emergency room, you need a blood panel, you need to tell them this, this, and that. I tried a few times, didn't work.
Right.
I've been gaslit. I've been told I don't fit the criteria. I've been told, oh, it's because you're in the sun, or, this isn't what lupus looks like. Your creatinine, your BUN, your GFR are fine, without them testing my sedimentary rates or my C reactive protein or anything. Um,
Without taking the
I've
family
had
history.
Yeah, and, like, telling someone over and over and over again, like, I spent 3 years of my life getting poked and prodded without official diagnosis, but just, like, monitoring. Like, I don't have children because they were like, "We don't want you to get pregnant and go into a spiral, or the medication that we start treating you with cause severe birth defects," because at the
Mhm.
time, methotrexate was their go-to.
Yeah.
And so methotrexate, you shouldn't try to have a child on for a while because it's a tetragenic,
Right.
which means it can cause fetal birth defects that are very severe and fetal demise. And so, finally getting a diagnosis was like, thank God.
Right. It was a relief at that point, because at least you know what's going on.
Oh yeah, I was constantly sick. A chest cold I would have for like 3 months. I would
Yeah.
have fevers of like 104 and 105. And
Mhm.
that goes back to my childhood. I had two illnesses when I was a child where my temperature was up above 104.
Wow.
And so when I get really, really sick during a flare, that's typically when I know I'm going to be a while.
That it's funny because a lot of our stories, they're completely different, but in some ways they are the same.
Oh,
You know,
yes,
because
absolutely.
in hindsight, we all can see where it started.
Yeah,
You know, and when you look at that, it's like, wow, why didn't anybody know? Why didn't it come up? You know, why didn't someone understand that I was in pain and didn't even know why I was in pain?
yeah.
It's
Um, I think one of the things is that there's certain organs that lupus tends to prefer when it
Mhm.
comes to SLE, or just different specific that it favors. And so if you're in an area where there isn't like a lot of people that are advocating, like this is going back 10, 12 years, a lot has changed in the last 10 years for people with lupus.
Sure.
And I thankfully worked at a teaching hospital, and my
Mhm.
boss actually referred me to the rheumatology clinic there. Like I had a horrible experience. The nurse who saw me that first day
Mhm.
sent me to the emergency room. She said, "Hey, ma'am, I really think you should go to the emergency room, get some blood work done, get some other testing done." And I said, "Can I just go home and go to sleep? Like, I just want to sleep. Like, I have
Body
no
was
idea why I'm
tired.
so tired." And the next morning, I couldn't breathe. I couldn't walk 5 feet, and I had such horrible chest pain. So my ex at the time was out of town, and a friend left work, came and got me, took me to the closest hospital, which was not my job, it was around the corner. And the triage nurse documented that I had drug-seeking behavior and there was nothing wrong with me. She
Wow.
didn't ask why I came to the emergency room. I just told her I was everything
Right.
hurt. Like holding the pen, writing my name, standing up,
Right.
everything hurt. Well, in my pocketbook, I had the paperwork from the equivalent of a urgent care, suggesting that I go to the emergency room 24 hours before, to be worked up for a onset flare.
Wow.
And that provider put me on a huge dose of steroids and anti-inflammatories. And it was like, quote unquote, a band-aid. And I was like, I just want to go home and go to sleep. And so when the ER doctor came in to ask me my symptoms, how long they've been going on, what about the rash on my face and stuff, I showed him this piece of paper. And he asked the nurse to excuse herself and was like, she's not drug seeking. Like, if this is an onset,
Mhm.
which it appears it's the first time, she doesn't even know what lupus is or what to expect. And we don't know what to expect.
Right.
And he asked her a trivial question. He said if she was African American and came in and said she was or excuse me, she said, "If she came in and said she was in sickle cell crisis, would you believe her?" And she
Right.
said, "No, because she's not African American." And he said, "But other ethnicities suffer from sickle cell anemia." And so she was like, "But she doesn't fit the profile, like, it doesn't fit her ethnic class." And so
Right.
he was like, "Very similar with lupus, like, no one knows that a person has lupus, so you can't just look at her and say she's here for drugs when she
Right.
was directed to come here." And so he
Right.
made her apologize to me, but,
Nice.
that was the first experience I ever had,
Right.
and sadly, it doesn't really change unless
It
it's
hasn't.
in your
Yeah.
chart.
Yeah. It hasn't changed, and it most likely won't change. I guess because of the implicit biases that are
Mhm,
actually taught
mhm,
in medical school. Some of it's so much that anybody who is not of the Caucasian persuasion has to deal with. Even
mhm.
women, even white men, black men. It's just so hard to break those biases and break those stereotypes.
So that challenge of, breaking those stereotypes really puts us as warriors in a very unique position. I know
Right.
several warriors that do not disclose their health. They don't disclose their health. Based on that experience, my boss was like, "Come to work, get all your films, your X-rays, everything else done." He sent me to a radiologist who had no
Hmm.
people skills. This man was scary. Like this man was very intimidating and scary, but he was really phenomenal. So I took him my blood work, I took him my X-rays, I took him my EKG, and he said, "You need to find a new doctor." And he said,
Hmm.
"I would recommend you going to rheumatology center here." And so
Hmm.
my boss actually recommended me. Another coworker had an autoimmune disease, and he knew the director of rheumatology and was like, "Hey, this is what's going on with her. She's really young. She's really sick. She's been in and out the hospital. Is there someone who can look at her?" And so there was a fellow who was in her final year of fellowship who became my doctor. And she's the one who had me break down the family history. She took me off of all NSAIDs. She took me off of steroids, had me change my diet, and really had me focus on different things. And
Hmm.
she's like, "It's not a matter of do you have it, it's a matter of when it'll be accepted that you have it." And
Hmm.
so, I didn't meet the criteria at that time. I would always have 3 out of the 11. Um, and so now the 11 has become a little bit more lucid because your family history and medical history play a part in your diagnosis.
Absolutely.
So, I finally got an official diagnosis. I got put on medication. I have a phenomenal team that work together, and I have a great relationship with them. And I know I'm super grateful, and I know I'm super blessed because of that. But I also know
Absolutely.
what it's like to see a patient in the waiting room with you, and then they become my patient in the emergency room.
Right. Right. Oh, that's got to be tough. That's gotta be tough. But I'm glad that they actually have you there because you can understand what they're going through and you can help them through that.
Oh,
It's it's
absolutely.
it's so important to have people like you in their lives that can help them through that. We all need help sometimes.
Well,
And I'm
thank you. Thank you.
and being scared and coming into the emergency room and having to go to through these scans and things like that. People can really lose it.
Because it's very challenging because, having being immunocompromised is not something that you want to run around a emergency department taking
Right.
care of patients every day. But I've learned to be very okay with starting a conversation with, "I'm immunocompromised. I have an autoimmune disease, and I need to protect myself in order to serve the patients here properly."
Absolutely. And you got to put that in your own mind. You have to change your mindset about it, not be fearful going to work, correct?
Absolutely. To me,
Absolutely.
it's a great honor to serve the communities in which I work with, but it's
Hmm.
also an opportunity for me to empathize with people with all different walks because, we're chronically invisible
Right.
and but we're very visible. And
Right.
so I never want anyone to feel chronically invisible.
Yeah, I understand that. And I feel you on that one. What are some of the pivotal moments or challenges besides the gaslighting that you have dealt with along the way?
Um, if
I
there's a
mean,
shock factor for some
mhm,
of the medical professionals who take care of me, especially when it comes to orthopedic or neurosurgery, they look at
mm,
my age, they look at my lifestyle, and all those years that I wasn't being treated, lupus was damaging my bodies, my joints, my
mm,
cartilage, different things. And so there's certain joints in my body that are significantly older than my biological age because of the illness, whether it's inflammation or breakdown and stuff. So sometimes that, even when they're there, like for example, I was sent for a X-ray of my hips, and then I was sent to PT because I did not see a fracture. But
mm,
immediately during my assessment, they knew that there was either a fracture or a torn muscle because the amount of pain, just pain.
mm,
And the supervisor of PT sent my rheumatologist a message and said, "We cannot continue with her PT unless she has an MRI because we're going to either further damage it, but we need to know what's going on." So with insurance and everything, they want you to wait 3 weeks or 3 weeks of sessions. They want you to go through the rigmarole of X-rays and everything. She was like, "Okay, fine. Let's get this going." And so she ordered an MRI. My MRI also showed no fracture, but it showed that I had a pretty badly torn labral tear
oh,
on my
wow.
right hip. And
Oh,
so it explained the pain, but there was no
right.
cause for it. And being in a technologist in this field, I'm not an MRI tech, but, the radiologist commented on it on a non-con, so a non-arthrogram, no contrast. That's how bad the tear was, that it was that
Mm,
obvious with no
wow.
dye. So he was like, "Why did you get sent in for a non-con if your pain is this significant?" I was like, "They're looking for like a hairline fracture and potential muscle or ligament stuff." And he was like, "You should have had an arthrogram with this so they can really see it, but the tear is really bad." And he
Mm,
was like, "And your left side is getting this bad." And
wow.
so I went back to the office, I finished my PT. I saw multiple surgeons about the tear and, about my joint. They're like talking about doing a total hip replacement at 36.
Good
And
grief.
I was like, "Huh?" And my doctor missed the tear. Like she completely missed it. She was like, "Elizabeth, are you sure you weren't reading one of your patient's charts? Like, are you sure?"
No,
And
really?
I was like, "Why would you ask me that?" And she was just
Right.
like, "Because, like, you don't have a fracture, like, there's no tear." So I opened it on my chart on my phone, and I read to her the report, and she pulled up
Mm,
the same note, and she just turned to me and she apologized, and
wow.
she said, "I wasn't expecting you to have an injury that bad. I really thought you had a fracture." So when it said negative for fracture, I just
Right.
continued on. And so, I'm thankful that she was flexible and accountable, and
Right.
I'm thankful that I have that relationship with her. But I've seen so many doctors and, it's like, okay, by the time I'm 50, I'm gonna have hardware. I've learned that I have fractures from L3 to my sacrum bilaterally
Ooh,
on my spine. And
wow.
that was a shocker. I was like, huh? Like I knew like L4, L5, but I have severely pinched nerves and they don't know how I did it. And it's just a combination of arthritis, lupus, body mechanics. And
Mhm.
so those are the things that kind of turn me off, especially because I'm a healthcare provider
Right.
and I work with bones. I'm in radiology. So when they're just like, "Oh, yeah, we wouldn't expect this of a non-athlete." I wasn't a collegiate athlete. I
Mm,
played, in high school for a few years, but I haven't been playing since I was a little child. Like, I
right.
didn't even
Right.
make varsity, so it's like it's not wear and tear from that. Um, and, so when they have that shock effect and then they're just like, "You're gonna need hardware to support your bones." It's very discouraging. Like, I've gained almost 20 pounds in the last year. It's the heaviest I've ever been. and I can't do bending and twisting or 90% of the exercises that I've done my whole life,
Right. Right.
because of injury. And so it's like giving myself grace, also like finding a team that is like very supportive. Like sometimes doctors just want to cut, other time doctors are like, let's just hold off on the knife, let's try everything else. Because once they start cutting, it can have other
Mhm.
complications.
Absolutely.
So the gaslighting, just
Mhm.
the minimizing of the pain,
Mhm.
um, the lack of ability to say, okay, can I bring a naturopath in? Can I bring, acupuncture in? Can I do this? So I've learned to get referrals from my doctor and really discuss with her all the options and discuss things with my PCP. And I'm so, so, so grateful for my team. Like, I can't emphasize how grateful I am for my team.
And it's so important. You said a couple of things that I wanted to touch on. You said that they had taken so much time to give you the correct treatment because they weren't giving you a diagnosis, and that created some issues in your body that probably wouldn't have been there if it would have been caught a little bit sooner. And that's something that's important because I think a lot of people want to do everything that they can not to get on any type of pharmaceutical medication. So talk to us about maybe like what do you think is the most important thing for people to understand when they're looking to get treated for lupus? I mean, the last thing we want is for people not to treat their lupus at all with nothing.
So let's look at a timeline. I was 27.
Mhm.
Initially, they wanted to put me on a high dose pack of steroids. I was on steroids, very high dose for 3 months. I was also taking 1,000 milligrams of naproxen daily,
Oh
which
my
has
lord!
significant effects,
Whew.
on your GI system, your liver, your kidneys, your stomach. It can cause gastrointestinal bleeding. It can cause several things, but that was their form of management. And so when the rheumatologist was like, I'm taking you off of that, you're too young, like, I'm taking you off. Let's get you on an anti inflammatory diet. Let's really assess your body monthly. Like, I would have urine and blood tests monthly. My
Mhm.
numbers were all over the place. And then I started balancing. Then I would go every 3 months and so on and so forth. I moved to Seattle and I saw her before I left. My numbers had been looking really good for a year, so she was, like, really confident. So we can
Right.
call it remission or we can call it I never fully got diagnosed. But
Okay.
when I came to Seattle, I work in healthcare. Every December, like the respiratory season, I would be sick from October till
Mm.
Mother's Day. Horrible sicknesses,
Mhm.
bronchitis, pleurisy, like, just
Oh my goodness.
pneumonia, like, just horrible, horrible. I would go through antibiotics, I would go through steroids, I couldn't breathe, I would have outrageous fevers, and
Mm.
so I would go in and I was saying, like, "Could this be lupus?" And because my chemistry didn't support it, it's like, okay. And so finally, off subject, but during the middle of the or at the beginning of the pandemic, there was these N95s that now fit me. I had to be in a PAPR like the whole time, the whole first year.
Mm.
There was 3 years of my life I did not come in contact. Every single day that I went to work, I came in contact with a COVID positive patient for 3 years, every shift that I worked.
Wow.
So imagine looking like a Ghostbuster or astronaut juggernaut with the respirator on. I had my own respirator. So I
Mhm.
knew I was protected. At the time my mother lived with me, um, I didn't hug my mother for over a year. I wore a mask in the house with my mother. I sanitized my house with bleach from the moment I walked in. My clothes were in the garage. I changed my clothes. I washed my hair every day. I went through all these precautions and I just felt horrible. And I called my doctor and I said, "Hey, my feet are purple. My ankles are
Mm.
swollen. My legs hurt so bad." The time I was on birth control, and I was like, "I feel like I've been run over by a freight train that hasn't stopped running me over yet." And I said to him, "This is how I felt when I had the rash on my face."
Mm.
And I said, "I don't have a rash right now, but my joints are red. They're warm to touch. I'm having fevers. this is before they even had tests for COVID, like before they actually had the COVID rapid test. And I was like, I just got off my cycle. Everyone thinks it's hormonal changes. And I was like, I am so physically weak. I can't even raise my hands. Like it's just
Mm,
everything hurts. And he said, how long has this been going on? I said, this is week 3. And he
mm,
said, I need you to come into my office. I'm going to do a blood panel on you. My blood panel came back slightly abnormal. And he said, what have they done for you that was successful for you? And I
mm.
said, high doses of steroids and
Right.
anti-inflammatories, because that was the only medication I was familiar with.
Mhm.
And so he put me on that and he asked me, he said, do you want to see a rheumatologist or do you want to wait to see if this happens again? And prior knowledge, I said I want to see a rheumatologist based on me working with rheumatology in Philly for so long. And
Right.
he said, totally, I'll write you the referral. I'll keep you on this. We need to get you better. So because I was on steroids for I think 8 weeks at that time, the rheumatologist couldn't run a few tests because they would be skewed, but she could run some other tests. And so I was supposed to see a different gentleman in her office. The day before, I get a phone call from the office manager saying, I cannot be seen because I come in contact with COVID positive patients daily.
Wow.
And like I wanted to cry because I
Wow.
waited like almost 12 weeks to see this person. And I was like, I'm your colleague. I work across the hall from you in the emergency department. You refer your patients to me, and I am a frontline provider. I don't have a choice. But as you know, what our hospital policy is, I am protected. I haven't been not protected. And I said, I don't care who I see, but I'm not going through this. I said, is there anyone who is a rheumatologist in your practice that will see me? Anyone, anyone, just anyone. I don't even care if it's a virtual appointment, just
Right.
anyone.
Someone that can tell me what's
And
going on.
she said yes. And so we got all my records from Philly for like the 3rd or 4th time. She started thumbing through all these things. She looked at my recent blood work and she said, would you be willing to get more tests? And I said, yeah. So she ran me for some DNA stranding tests, some C-reactive protein tests. She ran me for all kinds of things. And during that like 2-hour doctor's appointment, she said, you either have undifferentiated connective tissue disease, or you have lupus, or you have both. And so, based on the depth of that first appointment, when I
Mhm.
got the text message like 3 days later through my charts, no, you have lupus, I wasn't offended that it came through a message. I was thankful at that point. She
Yeah.
immediately put me on hydroxychloroquine, and that instantly, within the first 3 months, changed a lot of things.
Sure.
Um, it took about a year to get the dosaging right.
Mhm.
And it took a while to figure out things. So then I learned of more treatment options. I also started seeing a naturopath and a couple other things. But in the meantime, I've had emergency surgery. I've had pleurisy in the emergency room. I've had crazy counts, and they're just like, oh, it's because of this, or oh, it's because of that. And not knowing that I had lupus, every time I had a severe thing like emergent gallbladder removal, it threw me into a flare.
Of
So
course.
out of 2 weeks, I spent 6 days in the hospital.
Mm.
And so
So not
until it
only are you
very
working
hard.
in the hospital, now you're a patient in the hospital. You're going through all this stuff and still dealing with it all.
Right, and so I had to fight, I mean, fight to be seen, and then when I got
Mhm.
diagnosed, it was like, I was so grateful, and, I'm gonna say something, and I'm a strong believer in Christ. I'm a Christian. My faith is everything to me. The day that I got diagnosed, I was across the street. I came back to work, and 2 of my patients, one I later learned, the name sounded familiar, but I later learned, we went to similar schools. Seattle's a really small place.
Mhm.
But one was just a year or so younger than me. The other one was like, I think a year older than me. Both of them did not leave the hospital. Their final days were spent there. Both of them were patients with my same team of doctors, and their
Mhm.
cause of death was lupus complicated problems. And so it's like,
Mhm.
you know, um, the devil tries to scare you. And when I say that, it's like, I remember when I first heard the words lupus, I thought I was given a death sentence because
Right.
the people that I had come across in the emergency room, they're they had no quality of life because they were so, so sick. They were in organ failure. They had, necrotizing hips, and they were coming in at 20 years old getting hip replacements, or they're having heart attacks and strokes, and they're not even 30. And so what you're exposed to being
Right.
a healthcare provider, I see them at their worst. So when I got my official diagnosis, I walked across the hall and, you hear like nurses talk or PAs or MAs talk, and it's like, oh, your patient that was supposed to be here at 2 o'clock is actually in ICU. Can you have time to make rounds on them? And then you learn that that patient doesn't make it. So, like, I've seen somebody in the waiting room with me for a blood test or waiting, then they've become my patient. But I've also seen it where I've taken care of you as my patient and I end up in the room next to you during the same
Mhm.
shift.
Right. During the
So
same shift.
being humble, but also knowing that, like, something's wrong,
Mm.
like, something's wrong, and so I'll call my doctor. My doctor's like, "Are you at work?" He's like, "Yeah, check in." Like, "Check in." And it's like, "Okay," you know? And so trusting the healthcare system that I work for and represent and choose to be
Mm.
a caregiver within, choosing selectively which teams I'll be a part of, I had no choice. I had to communicate I had lupus because my team was relying on me to carry my weight in my department during a time where we're so critically short-staffed, where I had to let them know while I was in and out the bathroom. I'm on different medications with horrible side effects. I prayed to a porcelain god for like 45 days with one medicine, and I was just like,
Right.
"This is horrible." But I
Right.
spent a year vomiting, not knowing why, and
Now
I'd
you do.
rather be
Mhm.
sick for 30 days
Right.
versus, if you're vomiting longer than a normal woman's pregnancy, you're like, "Well, at least if I was pregnant, there'd be a baby at the end of this."
Right.
Like, we don't know why I'm having GI issues, you know?
I love
So it's
that.
like, "Wait, I've hit the
See, come on,
11-month
what am I
mark."
getting out of
So
this?
right. And so, I say all this to say, like, now I know there's other treatment options. I know
Right.
that there's medication, there's food, there's meditation. I know that muscle movement's really important for bone health. I know that talking to people, I've had people stand in my face and tell me, because I'm not on dialysis, there's no way I can have lupus.
Mm.
And so it's like,
Wow.
even educating yourself to know what other warriors go through, that's why communities like the one you created is so important.
Mhm.
Um, Learning, like, different side effects, like, how do you
Right.
manage this? I was put on I wanna be a mom more than anything else. I'm still not a mom, and I choose my medications that allow me the opportunity and potentially grant me the great honor of conceiving. I
Absolutely.
can go a different medication route, but that would close that door for me, and lupus has already partially closed that door because of how long it took to get the official diagnosis and the early advice that we got about restraining from having kids because if we
Mhm.
never knew how severe this would be.
Right. And you know what I like about what you're saying is that you took the time to educate yourself. And even though you were in the healthcare field, it's important that you educated yourself, you advocated for yourself, and you wanted to get the help and do what's right for you. Even all while you're working. I think that's important. What do you think?
Absolutely,
Uh-oh.
and not knowing why I was sick, I needed to know why. And
Right.
so, like, I'm not one to, like, skip going to the doctors or skip getting
Mhm.
your physical or anything like that. And so I needed an explanation, you know? And, I've met a lot of lupus warriors with all different forms of lupus. Many of them are chronic warriors of multiple diseases that cross over. And so you learn different things. And the one thing that I've learned just being a healthcare provider
Mhm.
is that you never know what someone's going through. You
Right.
never know what someone's pain level is. You never know what they're experiencing. So the only way I can adequately take care of myself, my loved ones, and show up as the best version of myself is if I'm well.
Right.
What people don't realize, I know you realize, and many of your viewers realize, is our level of pain on a day-to-day living.
Yeah. It's just
If
off the
we woke up without pain, we would wonder where we were, like, "What's
Right.
going
Wait
on?"
a minute. Yeah.
Like
Absolutely.
like, "What's really going on?" And so, I have chosen to share with my coworkers I have lupus. I choose to share with patients. I choose to start many conversations, but it took
Right.
a long time for me to get to that point because
Absolutely.
there's a lot of people that think, like, I start conversations when I go and speak at schools or public places. I'm like, "Hey, would you believe me if I told you I had a disease that has no cure?"
Right.
And it's like people are just like, "Huh?" And it's an icebreaker because it's like you never know what someone's going through, and lupus mimics so many things. It affects more than 5 million people worldwide, and more than 1.5 million of those people live in the United States of America, yet it's one of the most underfunded and
Mm,
under-researched diseases, and in the
mm,
last 10 years, we've only had 1 or 2 drugs go to market.
right. Right.
That
And
doesn't
it took 50 years just to get one.
Right. And so the math doesn't line up. Like, make it make sense to me. The math doesn't make sense. But
Yeah.
part of that is because there's so many diseases, there's so many illnesses, there's so many things. We have to choose to be vulnerable. And that's a choice to be vulnerable, to
Ooh.
advocate, to share our testimonies, to be vulnerable, and to know that there's safe spaces where we can
Mhm.
have community and find support so we can ally and rally together so we can gain that resource to educate others and find funding so we can find a cure and other treatments.
Absolutely. You said a mouthful right there. And that whole safe spaces is so important for people to feel like they're heard, like they're understood. And that is so important. I wanted to um, highlight this message here. It says, "Hello, I was recently diagnosed with CTD with mostly lupus symptoms. I have Guillain-Barré syndrome last year, so it's been a tough year. I haven't been diagnosed with lupus, but I have a feeling it might be early stages of it. That's what my rheumatologist told me. Week one of hydroxychloroquine and prednisone. How would you And y'all, I say advice, but we're just trying to give you some ideas as to how you would tell her to continue to be her own best advocate to get the proper diagnosis.
Well, I will say this, I don't know what CTD is in this usage. I do know what Guillain-Barré syndrome is. I am
Mhm.
very happy that she has a rheumatologist. I'm very also happy that she's on hydroxychloroquine. So for
Yeah.
anybody on here, on any of the platforms, hydroxychloroquine is the go-to starting drug. It is the go-to starting drug for many, many rheumatologists and many PCPs. It has shown great success rates in reducing and treating a lot of our symptoms and a lot of general symptoms of the joint pain and inflammation. It is classified as an immunosuppressant, but a lot of lupus patients have found great success on that, and it helps them. The prednisone, anybody who has lupus, and as well as many other autoimmune diseases, l- prednisone is used here and there intermittently to treat things to help your body. Some people are on a low dose for a long term, other people are on it as an as needed basis. So you may or may not be on that for so long. But I think it's so important that you're a part of a community like this, that you're reaching out, you're finding out things, that you have a rheumatologist, and that you're being vulnerable enough to share this. So I commend you for that. I would encourage you to write down your symptoms and write
Mhm.
a little love note to yourself. And when you notice things, take photos of your body. No one cares if you haven't shaved. No one cares if your hair is done, if your makeup's done. No one cares. I don't care. I see people in the emergency room every day. Take pictures, document the changes, pay attention to the food that you eat, the environment, Start writing down anything, if it's good or bad. That way your rheumatologist and PCP, because believe it or not, they're a team, they can understand what's working and what's not working for you.
I so agree with you. I always tell people to make sure you're keeping a journal of everything that's going on, what you eat, how it makes you feel, what your brain is saying to you when you're eating it. All of those will help you along the way as you see your doctors. Absolutely. Kimberly would like to know, what are your self-care tips? Kimberly is in my
Um,
my little phone here looking at my questions.
Hi. Sorry, I needed a sip of water. So I'm really, really big on self-love, and I'm huge on breathing techniques. I'm huge. Like we can all say exercise, right? But what does that mean, right? So we have to exercise our lungs. Our lungs, breathing in, slow, deep breathing that's controlled and intentional, provides oxygen throughout your entire body. That oxygen helps increase the blood flow and it helps nourish your muscles and stuff. So it's actually beneficial. It also slows down your heart rate, improves your concentration, helps reduce your stress, helps you sleep better, and immediately starts to calm your nervous system.
Absolutely.
So there's a breathing technique called box breathing, like a box, like a square rectangle box. And you basically inhale over the course of 4 seconds, you hold it over the course of 4 seconds, you slowly exhale over 4 seconds, and you repeat that whole cycle. And so no matter what room, what environment I'm in, I'm always teaching about box breathing. I'm a huge, huge, huge fan of it. If you meditate or do yoga, that is really, really great. But at least 2 minutes of your day, even if that's 1 minute in the morning and 1 minute in the evening, or 2 minutes in the bathroom, be intentional with your breathing. Also, journaling. I've been journaling since I knew how to write. And journaling is so important. Whether you're frustrated, mad, excited, happy, writing down your symptoms, writing how much the toilet looks disgusting when you're laying next to it and you notice little things on it you didn't know were there,
Right,
it doesn't matter. But journaling will really, really help you. And just having a support system. Having a support system is really, really big on my self care tips because if I need someone to take me to a doctor's appointment or go pick up my prescriptions or someone just to help me, just to
yeah,
help me in any way, um, us warriors, we don't ask for help. Like we don't ask for help. So if you come to my house and you fold my clothes for me, that's a massive help to me. It might seem very mundane and remedial to you, but that's huge to us. So giving yourself grace, having affirmations daily, telling yourself how beautiful you are or how handsome you are and how worthy you are, and giving yourself that conscious encouragement like, I'm still breathing. I still have a voice. I can still
absolutely.
use my voice. And just finding a community and finding a tribe within that community. Those are all ways you can care for yourself. But most importantly, as a patient, the biggest way you can care for yourself is to write your symptoms down, write down when you started taking a medication, write down as much of your diet, what helps, what doesn't help, because over time, that's a log, and that log is critical data for multiple people. We can't rely on Epic, we can't rely on my chart, we can't rely on a paper chart. We're all human. We oversee things. There's filters. We might not see a keyword or something, but you are your greatest advocate. Find someone that you trust to share your medical history with. Appoint them so, in case there's an emergency, they know what to do, and make sure they have access to that log so they know what's going on. The
Mm,
people in your corner who love you, they'll help you. They'll help be your voice when you don't have a voice or you're too weak to have a voice.
absolutely. All of that and all of that again. Say it again and again and again. And, you know, Elizabeth has given some really great tips. Write it down. Write it down so that you are not thinking about, oh my gosh, what did she say? Oh my goodness, I don't know where the video is. No, take a piece of paper right now and write it down. I know on the East Coast it's late. Y'all usually up anyway. So it's okay. Go ahead and get you a piece of paper and write these tips down. They're already listed in the comment section, please take what she's saying and use it for yourself. Now, lupus can impact relationships. It can impact work, it can impact social activities. What how has it impacted you, and what have you done to change your response or change what's going on with you in relationships?
So I wrote a book called The Mindset of a Graceful Warrior.
Okay.
And in that book, I actually share some of my journal entries.
Mm,
Um, I share about being sexually abused as a child. I
mm,
share about my divorce and
mm,
how my diagnosis of a disease that had no known cure with no known answers, meaning,
mm,
what is this disease going to do to you? And there's no cure. I lost my marriage because of it. I am no
mm,
longer married. I am not a mom. So lupus has taken a lot from me,
mm,
both physical capacity, like I can't go run a marathon because I can't have impact on my joints because of the damage that's already there. So I'm not a person to use the word can't lightly. Like
mm,
I'm very stubborn and I'm very hard-headed, but I understand the risk versus benefit and it will cause too much injury. So I heed to the doctors.
mhm.
And so lupus has cost me a lot. I took vows in front of my family. I
Right.
took vows with the person I love, but because of their uncertainty about what this would do to us and their
Mm,
inability to stand by me, I don't care how much money I make. I don't care how successful I become. I don't care about any of that. If you can't bathe me when I'm
mm,
soiled, when
mhm,
I'm not able to cut my own food, chew
mm,
my own food, if I can't get out of bed, if you can't, like help me with medication, my joint pain in my fingers and my hands is so bad in the morning that I can't grab things. I can't grip things.
right.
And so my ex would experience that and he was just like the deer in headlights. I don't
Mm,
fault him for it.
right.
I have my faith in God, and thankfully, he comes from an amazing family. I'm still really close to his family.
Mhm.
Um, my mom is no longer here with us, but my mom was Korean, and trying to explain to her what lupus was with a
Right.
huge language barrier, I
Yeah.
had relatives doing as much research as they could just to explain things, but I couldn't eat several things because I couldn't digest them. I have severe GI issues. So lupus has affected my life in so many ways. But lupus has also given me so much understanding of myself and so
Right.
much gratitude.
Yeah.
Because, yes, I have a name for why I have issues. Yes, there's no known cure for it now, but it will never define me. It will
Ooh,
never, ever break me. It will
right.
never, ever be the only thing that people know of me. But what it is something that allows me to have empathy on such a high level.
Right.
It
Right.
allows me to have compassion on such a high level. And it
Mm,
also just motivates me every day to use as many platforms as I can to
right.
raise awareness. There is not a single test. Lupus is not like HIV. I will say that again for the people in the back. Lupus is not like HIV or cancer. There is not a singular test to diagnose it. It is not a, yes, you're positive. It takes multiple tests with multiple specialists. There is not a singular test that says, yes, you have lupus.
Right.
That right there, that little fun fact right there is embarrassing. We need more research done so we can find a way that people can get diagnosed sooner and more accurately. It
Absolutely.
mimics so many other diseases that people's lives are so significantly impacted before they get an official diagnosis. Once you get
Right.
your diagnosis, the only thing that changes is your treatment plan.
Right. Exactly. Exactly.
So we really, really need to see that it can be destructive. It can cause different things. But
You can overcome them.
I you not only can you overcome it, but the more you learn about it and the more that you network and find different communities and find different people, you can learn techniques and tricks that you may not even known that are crossover. A lot of medications they treat lupus with, they also treat rheumatoid arthritis with.
Right.
They treat fibromyalgia with. Chemo meds are used to treat people with lupus. So you don't know about these things until you're in that position, unless you know other warriors that are willing to share their story,
Right.
open up and give their testimony and say, this is the route that I had to go.
Exactly. And you have to be open. Like I'll say it again, like you were open to doing what you needed to do to get yourself healthier. So I do believe
It
that we have to have that open heart in order to be able to receive this new normal of ours that
it's
includes treatment, if that
it
makes sense.
it's hard. I will say this. I'll say it this way. Patient autonomy is critical.
Hmm.
For those of you guys that don't know what autonomy means, it means for a patient to be able to make their own decisions regarding their own healthcare, which
Absolutely.
includes who knows about their diagnosis. It is no one's business but yours and your doctor's. You don't have to tell anyone that you have it. Some people are ashamed, they're embarrassed, they're afraid. Yes, is it considered a disability? Yes, many people with lupus have disability. Um, I chose over time to share with my coworkers so they knew what to expect of me. I've learned that the more transparent I am, the better my day goes. I've also learned that my support system is my lifeline. My support system is critical. It is very, very, very critical. I've had to cancel on people last minute. I've
Hmm.
had to cancel plane tickets. My white blood count is so low and my lack of neutrophils in my body is
Yep.
so low, it's not safe for me to be around people that's outside of my bubble, and I don't have a bubble. So if I can't see you and you think I'm a bad friend, but you're like you work in an emergency room around sick people, but you can't come by and have coffee with me, we can go have coffee outside where we're like 10 feet apart and there's open air,
Right.
because you can have a common code and it can land me in the hospital.
Exactly. Exactly.
I shouldn't have to stand on top of a mountain and tell you your germs can kill me for
Right.
you to respect that I can't hang out with you.
Yeah. Yeah.
So people will treat you differently. People will always say, there's always something wrong with you. Weren't you sick last week? Weren't you sick yesterday? How many doctors do you see? I've had family members tell me that they have cancer and in their early 80s, late 70s, and I have more prescriptions and more normal doctors than they
Mm.
do with all of their combined illnesses.
Wow.
I've had the same family member tell me that I need to go find a real doctor because there's no way I can have all these things wrong with me when I'm
Mm.
in my 30s.
My face shows it all. I know it does. But, so many people are going to doubt
Oh, yes.
everything because
And
of their age or who you are or what their beliefs are. And sometimes we just got to let those people go, even if they're family members, even if they're your spouses, even if they're, the people that you've been with all your life. It's just something that we have to deal with, and we have to deal with it head on. Absolutely.
the the greatest form of self-love is knowing that you're worth it. That is
Absolutely.
the greatest form of self-love, is to know that God has blessed you with another day and you're worth it. So if that means cutting off everybody that shares your DNA, hey, it's not
So
easy
be
to
it.
take the shears and snip, snip, snip. It's not easy. It's not easy. And before you start snipping, make sure you have a support system in play. Make sure you have a 24/7 friend that you can contact for anything. When you have to realize that your family doesn't believe you or your family doesn't support you or your job might be in jeopardy, there's things in the workplace that can protect you from losing your job. There are lots of things in place, but you have to do your work too. You have to talk to HR, you have to communicate with them. I got really blessed in the past where I had a supervisor say to me, I need to file for FMLA just because I had so many doctor's appointments and I was in and out the hospital. I wasn't too prideful. I said, thank you for your information. How do I do it?
Absolutely.
But
Absolutely.
it takes you willing to share
Mhm.
your story, and it's not easy to get to that point. The
Absolutely.
first thing that a lot of people experience when they get diagnosed is they're afraid. They don't know what it means. It's
Abs-
hard. Your life changes forever, and it changes in ways you don't know how it will change. I don't know how I'll feel tomorrow.
Right.
That lack of control is very frightening,
Right. Right.
but it makes me appreciate moments like this 100 times more.
Absolutely. I love it. I love your story. I love your spunk. I love your spirit. And I definitely am so proud of your fight. I want to be respectful of your time. We're coming up, I guess,
Oh,
we're
I'm fine.
okay.
I'm
So
fine.
I want to be respectful of your time, but I want you to give us, if you could leave our audience with one piece of advice, because you've given a lot of advice in here that people need to take heed to. But if you wanted them to tell somebody, I was on a live with Elizabeth the other day, and she said this, and it made me really think about my own fight. What would it be?
I have a question before I answer that. To
Sure.
a diagnosed person or to a person who may or may not have lupus that might be looking to see if they have it?
Give me both since you asked the
So,
question.
so don't be discouraged if you haven't gotten a diagnosis yet. Keep fighting for yourself. Keep
Mhm.
writing things down. And doctors are replaceable. You can get another doctor or see somebody else. Stick to your intuition. If there's something wrong, do not gaslight yourself.
Mm,
Do not neglect yourself and gaslight yourself. But use the tools that we've discussed multiple times during this live about keeping a journal and writing things down, because that is your voice. That is your voice in every room you go into. Once you get a diagnosis, whether it's lupus or a different autoimmune disease, or it's somebody you know that has lupus, it's okay to be sad. It's okay to grieve the life that you once knew. And it's okay to have a lot of questions. It's okay. My biggest advice to anybody is whether it's your faith, whether it's your support system, no matter what it is, build it 10 times over. Make sure it's very, very, very strong. You have to know how to love yourself in every state. You have to love yourself in the ICU bed when you're by yourself, and you have to love yourself when you're on a beach or in the mountains taking a hike. You have to be willing to accept and adapt to your new normal. And with that, the grace that you show yourself, others will be more open to learning about your journey, and they'll be more willing to help you and support you. But just know that no matter if you've been diagnosed or have yet to be diagnosed, you are not alone. There is a wealth of resources, both locally and internationally. It's okay to be concerned, but never, ever deny yourself the knowledge, because knowledge is truly the greatest power. I know health insurance plays a role. Having a chronic illness is very expensive, but you deserve quality treatment because you matter. Don't ever gaslight yourself.
I love it. I love it. That was so succinct and to the point, and very much needed, I'm sure, from everybody who was on this call. I so appreciate you coming on our platform and sharing your story with us. You are an amazing woman. Would you tell us, you
Thank you
said,
so much.
where can we find you at on the internet? I know you said it before, but please repeat it for me so I can type it in.
Sure, it's underscore I am Sunshin is my handle on Facebook as well as IG. I'm very seldomly on Facebook. I'm primarily on IG. And if
Okay.
you guys want to see more of me, you can go to my website at www.imsunshin.com. My book is available on Amazon, and you can get in contact with me either via my website or on IG.
Awesome, awesome, awesome. And what's the name of your book again? Because I want to make sure that people have that also.
It's called The Mindset of a Graceful Warrior.
I love it. You all got get a screenshot. Get your screenshots now. Go on over to Amazon and get the mindset of a graceful warrior. I so appreciate you.
Many
Go ahead.
many of the things we talked about tonight all come from this book. A support system, having faith,
Right.
having gratitude. accepting what you can't control. They're all the things that are mentioned in that book. That book was written before I got my official diagnosis, and I'm just very grateful for it, and I love it, and there's a lot of gems in there, but it's what I use my entire life through every scenario.
I love it. I love it. Thank you so much, Elizabeth. Thank you, everybody, for tuning in.
Thank you, guys.
Elizabeth, I'm so proud of you, the fight in you. Continue fighting on. And you've got a friend for life with me. So whatever you need, you let me know.
I appreciate it so much, and the feeling's completely mutual. I'm so grateful for this opportunity. Thank you for all that you're doing for the community globally, and just thank you for your commitment to the cause and your vulnerability by sharing your story and creating a safe environment for all of us to educate, inform, advocate, and to come together.
Thank you so much. Thank you, everybody. We so appreciate you tuning in, and I hope that you gleaned some great information from Elizabeth because she gave a lot. So I want to thank you all for tuning in, and we'll be back on the 20th with our nutritional session. So make sure you tune in at 7 p.m. May 20th. Ooh, my tongue is getting all dry.
Because
so
it's almost 1 o'clock in the morning.
So I appreciate you, Elizabeth, and I will hope to talk to you soon. You got somebody in here from the Philippines that was watching, so they wanted to make sure that you knew
Thanks,
that.
guys.
So
Thank
thank you so
you.
much for coming on, and thank you everybody for tuning in. And we'll talk to you on the 20th. All right, bye bye. Elizabeth, you stay right there for 1 minute.